I want to talk to you a little bit about another new project that we're taking on here at Searcy Denney. It's with respect to the drug Zofran. Zofran is a drug that was developed by GlaxoSmithKline and ultimately cleared or approved by the FDA for the treatment of very, very severe nausea in chemotherapy patients. That was the specific purpose of the drug. It's what the FDA reviewed, and ultimately the FDA approved the drug for that treatment. The problem is that in most cases, these companies can't help themselves, and they started promoting the drug for an off-label use. They started suggesting to doctors that it was appropriate to give Zofran to pregnant mothers who had severe nausea. The FDA never studied the safety or effectiveness of Zofran when giving to a pregnant mother. Recently, studies have come out linking the administration of Zofran to pregnant mothers to birth defects in their children. The two most prominently linked birth defects are cleft palate, or malformation of the child's lip and palate, and cardiac abnormalities, or malformations of the heart. In a recent 2014 study, in addition to making those links between the administration of the drug to pregnant mothers and those complications, a conclusion was drawn in that study that it was absolutely contraindicated to give Zofran to pregnant mothers. That makes sense. Let's go back to what the FDA approved the drug for, and that is to give the drug to people who are undergoing chemotherapy, who are not pregnant or anticipate getting pregnant. Then there's no risk to these infants. One problem we see in the litigation is that Zofran has been around long enough now that a lot of the administration of the drug comes in the generic form. I won't bore you with the details of that, but it can be very, very problematic for the lawyers and the plaintiffs to overcome a doctrine called federal preemption if in fact the patient was giving a generic form of the drug. We see that as the biggest challenge right now in the Zofran litigation. With regard to the Zofran litigation, it is early, very, very early in the stages. There are cases that are filed around the country. Currently, there is no petition filed for consolidation for multi-district litigation. To the best of our knowledge, there are no petitions filed in California for the establishment of a JCCP or for coordinated proceedings in New Jersey or New York or Pennsylvania, where those things typically happen. So that will play out over the next year, 6 months to a year. The next time we give you an update about Zofran, we anticipate that there will be some major movement towards coordination in one or more of those venues. We are accepting Zofran cases right now. We're investigating those cases. The first thing we're actually looking into is whether or not the patient was giving the branded drug Zofran or one of its generic equivalents. And we would be happy to discuss these problems with any parent who has had a child that has one of these complications and believes that they were given Zofran during their pregnancy to treat nausea.